Hi everyone. So I decided to make this video blog to document how I'm doing, and because everybody's asking me how things are going, and also to post this maybe publicly online in case somebody else is going through this same issue. I've watched some video blogs myself and I found them really helpful to know what to expect. So today is January 25th, 2020. And I ruptured my left Achilles tendon on December 30th. So I do gymnastics for fun, don't compete, but the past 2 years I got into more advanced tumbling skills, which I found thrilling. And you know the risks going into it, you just hope nothing bad will happen, but of course that's always on your mind. But I still feel like I accomplished a lot and I was able to learn to control a lot of fear. And right now I have no set expectations for recovery, but we'll see how far I want to take it again. I don't want to keep pushing myself the way I was, but it would be nice to still be able to tumble somewhat, even on the soft trampoline, soft mats, but we'll see. So right now I am in the second phase since my surgery, where I am partially weight bearing. So I will explain what happened. First of all, I'll show you a clip of the tumbling pass. It's not the actual injury, but this is the tumbling pass I was doing that caused the Achilles tendon rupture. So as you see in the tumbling pass, there's the one spot where I reversed directions, and it actually snapped right there. I didn't fall, I didn't trip. It was nothing really that I purposely caused, of my mistakes. It was just a lot of little mistakes in that tumbling pass that ended up with me landing really shallow with a slam really hard into that trampoline, more on the left side. And that tumble track is a long, stiff trampoline. So it's not as hard as the floor, but it's a lot harder than a softer one. So had I landed in this manner at rock and jump with soft trampolines, I'm not so sure it would have ruptured. But I also landed kind of on the side of my foot, causing a little bit of a sprain to the outside of the foot. So I don't know, I'm going to ask the doctor if that could have something to do with it as well, because the pressure probably is going up into the Achilles in the wrong part of the foot. Your foot is not absorbing the shock like it should be. So when I did it, I was in the middle of it and I felt and heard a pop. They call it like the gunshot sound. I heard it echo across the whole gym, and it was kind of embarrassing at first. I thought, oh, I cracked a joint. So as I was going into the front flip part, I just bailed and landed on my butt, on purpose, because I knew I didn't want to land on my feet. I thought at first that I had just sprained my ankle, because there really wasn't any kind of pain, although I did feel a little bit of a tickle of something moving at the back of my heel, which was probably the tendon moving, but there really was no pain other than the fact that I felt like I sprained the outside of the foot. So I get up and I said, oh, I'm fine, and I start walking on that trampoline. I was almost to the edge where the mat was, and my foot is really weak and floppy. I could still walk, but barely, and when I knew something was wrong, I'm like, I'm sitting down, I'm not putting weight on this. So I'm like, please get the ice. So my coach came down and she's looking at it, and they got the ice, and she says, it feels like your Achilles. And then a little girl who's in the gym, who comes quite often, she said her mother was a nurse. So the mother, we called her down and she's looking at it too, and she says, yeah, it looks like your Achilles. So immediately I'm thinking, oh no, I'm going to need surgery, and scary thoughts about that, but I'm like, I hope I can still come back to gymnastics. And she's like, make sure you get to the hospital tonight. She wanted to call an ambulance, but I said no. It was my left foot, I could still drive. I wasn't in any kind of pain really, other than some swelling. So I was able to drive. I called my mother, we share the apartment, so she's like, come home, because they're like, how are you going to hobble to the ER? I had no crutches, no way to walk. But yeah, I saved myself like $100 copay for the ambulance. I did not need that. It wasn't that terrible, but we went there. They actually braced me at a 90-degree angle of the foot. She did the squeeze test in the calf, which showed that my foot wasn't moving, so it's not attached to the calf, which means I looked like I ruptured my Achilles. I got set up for an orthopedic appointment, a follow-up, a few days later. So we went there, and he immediately knew when he felt it, and I was trying to push my foot against his hand. He's like, "Yeah, you ruptured your Achilles," which I had already read about surgery being the best option. So that's where we went, and I know I made the right choice because I wanted to be active again. And if you don't get surgery, it actually just heals with a larger scar. The tissue's not as strong. So in general, it seems to be that way. So surgery, they actually just bring the tendon back together, and so then it's able to heal with less of a scar and be stronger. And so that's what he recommended as well. I could go back to gymnastics in a year if I work really, really hard and tumble, so we'll see. Like I said, I don't have any expectations right now. I just want to get through therapy and see where it takes me. He's all for dancing, so at least I can definitely go back to that. So other factors he said, like I'm at that age level of what's called the weekend warrior, the people that just go out on weekends really, or just quick spurts of large energy activity, and you're kind of sitting all day else the rest of the time. And I know that my ankles weren't conditioned the way they were in dance, and that tumbling pass is actually very hard on the ankles, and I noticed that as I practiced it. And before I went, I even said, this is really hard on the ankles, so I probably should have at least done better at strengthening my ankles. But what's done is done. I mean, injuries happen. So he also mentioned my hydrocortisone pills as a factor, because I guess they weaken tendons, which I did not know this. Hydrocortisone shots, even in joints, can weaken tendons. So they don't like to keep giving those to athletes. I had to take the hydrocortisone because of adrenal insufficiency, a mild version of it, which I had been off the medication. I actually improved, but probably it had somewhat of a factor. But honestly, I think the way that I landed and how hard I landed, it probably would have broke either way. So when I went there, he actually gave me this boot to wear. And I wore it for about a week because my surgery was scheduled a week later. I'm still trying to figure out sometimes how it latches. At the hospital, they gave me this shoe to put over the cast. Just a regular, like, funny slipper. But then once I went to surgery, I woke up with a cast with my foot sort of halfway between pointed and flexed. So I had 2 weeks in that cast where I could not put any weight on the foot. So it's a lot of work to crutch around without putting any weight on your foot. So I can show you a clip of how I crutched around. Another thing that was really helpful was this desk chair. It became one of my best friends along with my crutches. I could actually carry things by scooting along in this chair, because when you have crutches, you can't carry anything unless you have a backpack. Another thing I want to mention is I have this simple folding stool from Walmart, if you can see it. I almost got rid of it before my injury, and I'm glad I didn't, because I put this in the bathroom and I sit on it to brush my teeth, and I monkey over it between that and the counter with my arms, so then I can get easily to the tub, to the toilet, and back. So that was another one of my best friends. So after the surgery, I was put on hydrocodone, which I only needed for about 2 days, and then I took it at night for a couple of nights, although I found that it was keeping me up. But the pain was very minimal, and I was surprised. I also got anti-nausea medication, which I didn't need any of, and baby aspirin, which I have to take for a month. Before my surgery, I actually went out and bought some glucosamine and collagen, because there's some studies that show that, preliminary studies, they're showing that it seems to be helping tendons repair themselves in a more organized and stronger manner, because when they're scarred, all the tissue is tangled up. So you don't want that. You want it healing as well as possible. So about a week or half week ago was my appointment My surgery was January 7th, and then my next appointment, it was 2 weeks after that, this past Monday, and I am allowed to weight bear, which is a huge relief as far as functioning. So I can show you a clip now of how I'm weight bearing on crutches. And at first I was really slow at it, but I'm actually getting better and getting better at a pattern of putting my weight down. So the next cast they gave me, I went to the appointment, they took the old cast off, they took the stitches out, and I was actually pleasantly surprised how small the incision actually was. I'll try to show you on my good foot. Normally they're going to cut all through here, but actually he did minimally invasive, so I had 2 holes here and 1 little scar there. So I was actually just really surprised and happy, and he did say the surgery went perfect. He did his best to keep the scar as small as possible, and he said he gave me extra anchors in there with the stitching so that it's an extra strong repair. No reconstruction needed, which is when they take tendons from like your toe and help repair it, so that was good. And in case anybody doesn't like stitching pictures, I'm not showing one of those. For those of you that know me, you can email me if you want to see it or text me. It's not that bad. But yeah, so they put me in a new cast. Now I'm at 90 degrees again. So he had pushed my foot, which that was the most painful part of everything so far. It was so stiff. He really had to push that foot, and I thought he was bending it backwards, like it hurt a lot. And then he's like, I barely got it to 90. It's like barely. So I don't know if you could see this. So this is the weight bearing cast. They made it really thick under here, and I picked white because I'm going to decorate it. I could have picked a lot of different colors, but I think later on tonight actually I'm going to work on painting something on it. So also the hard part about having a cast is that you have to take a bath really, and you can't get the cast wet. So something that was helpful, they told me to get before the surgery, we went out and got it, a cast cover. So this thing just like, the inside piece goes over your leg, and the inside piece you wrap around the top, and you pull this tight, pull it tight and wrap it, seal it. It's like a terry cloth, and then this piece goes right over it. And you yank this, I yank it as tight as I can stand, and clip it and pull it. It's getting a little beat up, but I mean it's doing the job, and it'll get me through the months that I'm in a cast. Hopefully next week it'll be good for the boot, so I'm thinking I'll be using the same boot, but you never know, they give you a lot of different stuff, and it's like, I don't know what I'm going to do with all this, but you don't use it for that long, but maybe the boot's going to be a month or 2, I'm guessing. Until then, he gave me this funny shoe now to put over my cast. This one actually has the toes closed up, so it's not all open and cold like the other shoe. It really hurt at first to try to weight bear, but in less than 48 hours the whole foot loosened way up, which I was glad, and I'm doing a little bit of stretching, and normally if I sit in an L I can get to my toes to my wrists. My feet go like, my arms go past my feet, my hands. So right now I've got the repaired leg about to here, so I'm actually pretty pleased because I was wondering if I even have any flexibility at all. And I know over time that does loosen up, and that's part of what therapy does. So therapy is going to be like 2 to 3 times a week for the first month, and then it kind of depends how you're doing. And I will see about documenting any updates as I get better. I do hear it's generally about 6 months till you can get back to like normal aerobic activity. The tendon takes about a year to fully heal, which is so they don't want you doing anything crazy until then. But I think I also heard it's generally around 3 months so you can get back in a regular shoe. And, you know, I'm so dependent now on the crutches. I'm like, I hope I can get confident enough to go into the shoe. Right now, I'm not sure exactly how much weight is too much, so I'm kind of just taking it easy this first week, and then maybe next week add a little more weight and see how it goes. So the more that I practice, the better it goes, and so that's been my update. I hope you found it interesting enough to keep watching, and maybe I'll post some more in the future. Thank you very much for watching.